Hello, everyone. I'm here with Dr. Marlies, and she's been very kindly given us some time to speak to us. So, hello, Doctor. Very kind of you to join me. Giving the floor over to you. Just give me some background. Who are you? How long have you been in practice? Just things like that.
Hello, I'm Marlies Fischer-Gerber. I qualified in 2007 at the University of Pretoria. After that, I worked for 3 years in public sector, and after that, I went into private practice. After that, I actually went back to work in public sector for 3 years again, and I'm back in private practice at the moment. But that's me. Yes, I'm mother of three, very busy kids, and yeah, I think that's me in a nutshell.
Brilliant. Let's fall right into it. When you think about your history of treating pregnant ladies and when they come into your practice now, do you feel there's a gap between the correct guidance and advice with regards to doing correct exercises for pregnant ladies and obviously afterwards?
Yes, I think definitely. I think from my experience, I think most pregnant ladies don't exercise at all. I think they stop completely to do any exercises. They definitely, it's not a big thing to exercise while you're pregnant. I had a few patients who did exercise during pregnancy. I'm not sure though that the people who helped them or trained them actually knew what was safe and what wasn't safe. So I think there's a huge gap there.
Okay. And you saying that you feel they don't exercise, do you feel then out of your professional capacity that they should be active during their pregnancy? And if you feel so, why do you feel so?
I definitely feel they need to be active during their pregnancy. I see that a lot of ladies, especially in the public sector, we did a lot of deliveries. And these ladies are, I think, unfit is the best way to describe it. They get exhausted during the delivery process. They're not strong, so they can't properly push. Also coming a lot during the pregnancy with backaches, poor posture, and things like that. But I definitely can see that these ladies are not strong. They're very, very weak. They have poor muscle quality, and they also, yeah, I think they get exhausted, they're tired, they can't sleep properly, but they have very, very weak muscles. I think also a low muscle mass as well.
Okay. And you said that you've seen a few ladies that do exercise in your practice. Can you see then there's a marked difference between those who exercise and those who don't exercise?
Yes, definitely they have a better posture. They don't come so, yeah, I don't think they come a lot to complain. So that's also a very good thing because I don't see them a lot while they are pregnant. I just know them because they are my patients. They're definitely stronger, and also afterwards, they do recover quicker after the delivery process. So seeing them for their postnatals, you can definitely see that they are strong already. They have a better posture, they carry the baby easier, all of those things, definitely. They're just more comfortable because you see these weak ladies, they struggle to get on the bed. Basic things like that. Yes, definitely. They're stronger, and I think their self-esteem is better, definitely, and more confidence with handling the baby and everything.
Well, I think you've actually touched on my next question because that was the one basically common issues that you would see that would actually help them when they exercise during pregnancy. So we've touched on posture, we've touched on self-esteem and confidence. We've definitely touched on, as you said, weak. But I think I want to reiterate to everyone listening that if you are not strong during pregnancy, it's going to be a massive task for you at delivery, because you and I both know, I've got 2 kids, you've got 3 kids. It takes a lot out of you to push that baby out, and you are basically absolutely knackered afterwards. But if you should think about, if you're strong, and I tell everyone, if you don't go run a marathon and not train, so I don't think you should be pregnant and not prepare your body for it. So I think that's a good thing. I had a lady yesterday. We spoke about restless legs. Is there any advice from your side, being a doctor, that you can give these ladies, of how they can kind of deal with these restless legs?
I think definitely to get a proper posture to sleep in, or a proper position, sorry, to sleep in, that you are comfortable with. Definitely magnesium as well. A proper magnesium supplement would definitely also help for that. And then also to stay active during the day. Keep your legs busy when they are supposed to be busy. Don't sit the whole day. Yes, keep busy during the day, and when it's time to sleep, also I think keep your mind clear that now it's time to sleep. Get a proper posture. Tell yourself, I'm comfortable now. I'm going to sleep now. But magnesium, I've seen it does make a difference.
Brilliant.
Take a proper supplement.
And obviously, when you take a supplement, you should actually advise your doctor first to tell you how much, or is that something that they can go to the pharmacy with? And
definitely, I think talk to your doctor, get a supplement that's safe during pregnancy, because some of these supplements have added add-ons, other supplements included. It's not only magnesium. So just please make sure it's a safe supplement for you during pregnancy. That would be the best thing to do.
And then another thing that most ladies ask is nausea. So we all know that first trimester you get that morning sickness. Some poor ladies have it basically through into the second trimester. What can they do if they still want to be active, but they're really struggling with this nausea problem?
We do have safe antiemetics for pregnancy on the market, but I think I like always to first stick with the things that is not medication. Definitely eating smaller meals, more frequent meals, but smaller meals. Don't eat large meal. Also to eat something before rising. I mean, even before sitting up in bed. And stick to your things with ginger. I know everybody knows that the ginger is good. It's not helping for everyone, but it does make a difference. Eat something before you rise, even before sitting up in bed. Eat a ginger biscuit or something. Small things like that. But I know it takes away your energy as well, if you feel nauseous like that. But also to exercise will also help you to be healthier in general. So the nausea will be better if you exercise. You don't have to get tired and exercise yourself until you're feeling sick. Just the mild exercise, I'm sure you will know, will teach them exactly what to do. But definitely it will help. It will definitely help. Also, if you are active and you don't gain too much weight, the reflux will also be better, because lots of the nausea is related to reflux. And in the first trimester, it's not, because we always think it's because the stomach gets big, or the baby gets big, so it presses on your stomach, causing the reflux. In the first trimester, that's not the case. It's actually the hormones that relaxes the sphincter of the esophagus getting into the stomach. And that relaxation is causing you to have reflux. So some of the nausea in the first trimester is related to that, to reflux. So yes, definitely get your abdominal muscles strong, stay active, stay healthy in general, but eat small, frequent meals.
Okay, that's very excellent advice. Thank you. And then from your professional experience and opinion, what are the conditions that will really benefit exercises during pregnancy? So we might think, we touched a little bit on it, back pain, restless legs, nausea, anything else you might think of that might really be, if you exercise, you definitely won't fall into the bad path of having back pain, or I'm just thinking about, we touched on it as well, picking up weight. Anything else you might think of?
I think definitely urinary incontinence, stress incontinence. All of the ladies come after delivery telling me they can't jump with the kids on the trampoline anymore, or when they laugh, or they sneeze, or they cough, then the urine is leaking. Definitely those pelvic floor muscles, very, very important. In exercise really does make a difference, and getting those muscles strong during pregnancy definitely will help you afterwards as well. I think that's a big thing, and it's also a complaint that I see very common.
Okay. And do you see a lot of ladies that's got like diastasis recti, where the abdominal muscles split?
Yes, definitely. I see a lot of those. And I'm not sure why. You might be able to tell us the reason why, but I see it in smaller ladies, not necessarily big ladies. Usually, it might also be that we see it easier in a lady that's thin and that's not very obese. But then you have this very tiny lady, and she's actually looking after herself very well, and she doesn't like to have diastasis rectus. It's not cosmetically, it's a very bad thing for them.
Yeah, mostly with diastasis recti, it's basically because well, as your body makes room for this growing uterus, the abdominal muscles split, and then you get ladies who's really going for it and they want to make sure that they stay active, but then they do the wrong exercises during pregnancy, where they overwork their obliques. And if you overwork your obliques, you think about as they attach to your abdominal muscles, they actually start pulling your rectus even further apart. And then when you get after pregnancy, it's almost like, right, now I have to get this tummy flat. I have to do loads of crunches, loads of abdominal work. And then they still just keep pulling that apart, keep pulling that apart. And it is like that hormone that you talked about, the relaxin hormone in your body, that's basically in your system, and it can stay in your system for up to about 9 months after pregnancy in some women. So if you think about it, if that relaxin hormone is still there and you're overworking those muscles, you're just going to cause that to come further and further apart. And I think it causes a lot of issues, diastasis, with regards to back pain, having that kind of feeling like everything is just sore because the pressure in your abdominal cavity is not what it should be because of that gap. And then, yeah, obviously, do you see any ladies like with SPD, symphysis pubic dysfunction, where they kind of have a pubis issue?
I don't think I've seen many of those. Yeah, I don't think it's not a common thing that I see. It will definitely exist, but me, I don't have experience with that.
It's interesting because in the UK there's a lot of things like that, whereas in South Africa it tends to not be as many. So it's quite interesting. And then what would you say with regards to like obstetric diabetes and blood pressure?
Yes, we see a lot of patients with high blood pressure, but we also have a big problem with obesity. And definitely I see it more in the obese ladies. They have a very, very high tendency of getting high blood pressure and pregnancy-induced diabetes. Also, but definitely related to obesity. It's a huge problem with obesity.
But you think it's still safe to exercise if you have got high blood pressure?
I think it would be excellent to exercise. It will actually take away the cause of the high blood pressure or the cause of the diabetes, getting them in shape, getting them healthier, getting them to lose fat, not necessarily weight, but getting them to lose body fat will definitely improve their blood pressure and glucose control.
Good. And then lastly, can you think about any conditions that you as a doctor would advise do not exercise?
I would say severe hypertension. If you're like having like risk factors with extreme headaches, first get that under control and then you start with the exercises. I would say definitely people with low-lying placentas or placenta previas, bleeding during pregnancy, unexplained bleeding, or I think PV bleeding during pregnancy. I think first sort that problem out. I cannot think of anything now, but sure. That's actually a difficult question, but
no, it's I think, yeah, it's mainly the things that you've touched on that that I would also advise my patients not to exercise. But yeah, it's I think it's, as you said, if you've got an issue, go to your doctor first, get that sorted, and then go on to have a healthy, confident, strong pregnancy. It just makes sense, really.
Yes, that sounds like good advice. I think that sums it up completely. Yeah.
Brilliant. But thank you so much for your time. I really appreciate it, and good luck for the rest of the day.
Thank you. Thanks for the opportunity.